We just finished spring break, which means a lot of wisdom teeth came out, and one question gets asked more than any other, which is, can I use a straw? The answer to that is most surgeons will say, please don't use a straw. It increases the risk of dry socket. We don't want you to get dry socket. What exactly is dry socket? Dry socket has been around for over 120 years. It goes by the name alveolar osteitis, alveolitis localized osteitis, alveolitis sicca de la rosa, which is one of my favorite. But really, what is it? It's hard to control pain within the first week after a surgical extraction. And as far as contributing factors to that, some you can control, some you can't. Some are hard to actually study, and others are well documented. One of the things you can't really change is the degree of difficulty of the teeth. You can control, obviously, the experience of the surgeon and who you choose. Smoking is something that you potentially can stop, and we have 4 good studies that show that it does have an increased risk when it comes to using a straw. It was thought that potentially that increased suction could dislodge that blood clot. That early breakdown of the blood clot causes that area to heal at a much slower rate. But 2 major studies showed that the increased suction or use of straw really did not cause it. We just tend to err on the side of caution and say, here's a big old list of do's and don'ts, and these potentially will keep you feeling much better. But one thing that is really not a controversy is it's easy to treat. So if you end up having pain that feels like it is not very well controlled, just talk to your surgeon about it. Give them a call.